Hello, I'm Dr. Tom Loeb from L2 Bio, and I just want to introduce you to your harvesting kit. So this is the box that it will come in, and let's open the box and see what we have inside. So the first thing you'll notice is the fat harvesting kit checklist. This should have all the items that you need in your kit. They should be checked to make sure that that you have everything that's supposed to be there. And then we'll kind of go through these items one by one. Inside you'll find a bag that has everything that you'll need, and I'll go through these items as we take them out just to explain what everything's for. This is actually a discard cup. It's not sterile, you'll use this cup for when you have excess solution and you want to keep the fat in the syringes. You will end up discarding some of the solution the way you keep the fat. You just kind of put this in here. It's not sterile, so we'll keep that off to the side. You'll end up having two different types of cannulas. One cannula is actually labeled Caraway Harvester. This is the tube that goes on a syringe that you'll actually use to harvest the fat itself, and then it's got some little holes at the end that you'll see that brings the fat out. And this is another infiltration cannula that we'll use just to infiltrate the area that we're going to harvest with the anesthetic solution, the tumescent anesthesia. In addition, you'll have a single-use Johnny Snap two-position syringe clip that actually helps supply the suction to the 20 cc syringe that you'll have inside the kit. You'll also find a pack of sterile towels. So after the patient is prepped, you'll use these towels to make the field sterile so that there's no contamination. And what we typically do is use a Mayo stand or something similar, and we'll unfold the blue paper and lay that out on the Mayo stand so that you have a sterile field on which to work. That just saves you additional towels. You'll end up having two 20 cc syringes. These are the syringes that we use to both infiltrate the solution and to pull the fat out from the harvest. You'll have a ChlorPrep prep stick that you use before you put the drapes on. It's just to sterilize the field. So that's inside the kit. You're going to find some sterile gloves that you can use. These are sort of one size fits all. So if you prefer your own gloves, certainly that's your preference. But we supply these with the kit. You'll have a bag of saline, a 250 cc bag of saline that you'll use for making up your tumescent solution. So that's inside the kit. And then once you put the materials inside this, you'll actually use a syringe, a blunt tip syringe through here with a syringe to kind of draw out the tumescent solution as you need it. Here's a 5 cc syringe that we use for some additional lidocaine and bicarb just to make the skin wheels before we make the little incision. This kind of helps prepare the skin with anesthesia so that the patient experiences no pain when you begin the procedure. You have an 11 scalpel blade. Once you have the skin wheels made, you can use the 11 scalpel blade to make just a little small nick, just big enough to put the cannulas in. You don't want it too big, just big enough to insert the cannulas and get you started. We supply some sterile gauze in case you need this to mop up any solution, if there's any bleeding at the skin incision site or any solution that comes out during the process. And so there's one pack of sterile gauze that you can put on your sterile field. These are a couple of absorbent pads that you can put over the two incision sites after the procedure to absorb any excess fluid. Patients can certainly get more. In addition, you have an abdominal binder that will fit around the patient's waist, whether you do an abdominal harvest or a back harvest. This should cover that and provide some compression to help the fluid drain out over the next couple of days. You're going to find some solutions in the kit to make up your tumescent. We've supplied you with a recipe, but you have 1 bottle of sodium bicarbonate, you have 1 bottle of 2% lidocaine, and then you have 1 vial of epinephrine to make up your tumescent solutions. It's a standard Klein solution, and you'll make up just enough to make up your 250 cc saline bottle. We supply you with some alcohol swabs to wipe the top of the bottles as you pull out the drugs to make your tumescent solution, and also to prepare the skin if you want for any injections. You have a 30 gauge needle that we use for injecting the skin. It's a tiny little needle, so when you make the skid wheel, the patient won't feel it. We have some blunt-tipped infiltration needles that we can use to draw up the solution from the bicarb and the epinephrine and the lidocaine to put into the tumescent bag. And you can also use this blunt-tip syringe in the saline bag just to draw up your solution. So we'll actually give you 3 of these with your kit. In addition, you have a sterile conical centrifuge tube that we use. It's going to be sealed at the top with a plastic sealer just to ensure that it's sterile. And afterwards, you're going to label the kit with a patient label. And my suggestion is these labels come off, so I would use some Scotch tape to apply them, and then some parafilm just to put around the top of the tube just to secure it. And that's pretty much the kit as you'll receive it. And if you have any questions or concerns, please contact L2 Bio. You can call 773-620-1850 or contact orders at l2bio.com. Thank you.